So my one and only announcement is that I get to introduce Diana to you. She's our financial program manager for the HealthTree Foundation, and she specializes in financial help for multiple myeloma and acute myeloid leukemia patients. As a professional financial advisor and former caregiver of her husband who is diagnosed with multiple myeloma, Diana perfectly understands the financial issues facing cancer patients. And not only does she understand them, but she wants to work to help you live as financially healthy as possible in your life. So, with that being said, Diana, I'm going to turn the time over to you for the latest financial updates.
Great. Thank you, Audrey. Hello, everyone. Thank you for joining us on this beautiful summer day, at least here in Louisville, Kentucky. I hope you're enjoying weather where you are. I wanted to go over this because this seems to be the most pressing topic that most of our patients have regarding Medicare. There's always changes, Medigap, when to get it, what options you have. And so I want to spend some time with this. What you will notice is I will not talk about any deductibles, changes in deductibles, or copays, because a lot of that information is not out. That will not generally come out until early September, maybe late August and September for the open enrollment period starting in October. So we're just going to go over the changes that came in effect 2023, 24, 25, and then we'll go over some things that are trending that I really think you guys need to know. The big thing I think everyone needs to understand is what's going on with, you hear a lot of the healthcare are being bought up, other healthcare facilities, maybe medical facilities are being purchased, and a lot of people are scrambling at the last minute, not knowing until the doors are closed that they have to find prescriptions, they had to find new providers. There's a big one that happened just recently. Compass Medical in Massachusetts, over 70,000 people overnight found out they no longer have care in those facilities. This is something that's trending up. You're going to find a lot of that going on. Some hospitals are closing, healthcare is being bought out. I think CVS is one of the biggest health providers right now. So there's a lot going on. You need to be aware of what's going on. Keep updated on the options available for you for your private care, private pay through your employer, because they will be making changes as well at the end of the year. Look at your Medigap, Medicare plans, and make decisions based on what's happening and what's best for you. Don't just get in something and leave it, because they change all the time, especially in the market right now. So please be aware of that. If you have any questions, feel free to reach out to me. Okay, so the thing we're going to go into now is we're going to talk about Medicare, especially Medicare Advantage. We're going to talk about the Medicare Part D, the prescription plan, and we're going to talk about Medigap. A lot of people are confused about when they can get into Medigap, when they can change out of Medigap or Medicare to Medigap. And so we need to go through that so you'll take advantage of opportunity when it's presented to you, because once it's gone, you may not be able to get into it. Next slide. So things we'll cover, we'll review the prospectus on Medicare Advantage plans, how to prepare for the upcoming enrollment period, search options for doing comparable plans, review upcoming changes to Medicare Part D prescription plans, which is really big for people who have really expensive prescriptions, and what you need to know about Medigap. Huge. People seem to put Medigap on the back page, but I'm telling you, if you did your comparisons, I know Medigap premiums may cost more, but there are so many better options you may find with Medigap over your Medicare Advantage. Next slide. So in 2022, I don't know what the 2023 is going to, I think they're going to trend up. Approximately 48% of Medicare beneficiaries were enrolled in a Medicare Advantage plan instead of original Medicare, because they want to fill in those gaps that original Medicare does not cover. And why is it so popular? Additional benefits, because they offer additional benefits such as dental, vision, and sometimes gym memberships. And unfortunately, I think this sway a lot of people. But remember, you're trying to get health care. We're not trying to get dental care, we're trying to get vision. The big expense out of your pocket is health care. So I think a lot of people see those as really big add-ons. And in fact, they may not, especially if you have a disease like cancer. So everything, including prescriptions, are bundled into one. That's used to be called Medicare Part C, but that is your Medicare Advantage plan. Next slide. So there's some potential problems with Advantage plans that people don't seem to realize. You may be limited to your network providers, people who are in network, and people fall in and fall out, change their mind about being on providers like doctors may say, we're no longer taking Medicare plans. And that is because the payouts, and there's a lot of going on right now, maybe reducing the payouts to providers. And so providers are saying, well, we can make more money off of private care. And unfortunately, when it comes to healthcare, it's all about the bottom line. Unfortunately, I think a lot of healthcare suffers as a result of that, because people have limited access to care, especially if you're already in an area that getting access to care is difficult, like suburban areas or rural areas where a lot of hospitals are closing, smaller hospitals are closing, especially since COVID. But also, Medicare Advantage plans often require pre-approval to see a specialist, and that can be a time drain. I mean, if any of you know that you may need to have maybe be approved for, like, let's say a stem cell transplant, and the time for that to turn around, they may have to go appeal it. There's a time drain on sometimes getting pre-approval or pre-certification. And Medicare Advantage can saddle Medicare beneficiaries with high out-of-pocket costs for serious conditions, such as cancer. And it can be detriment to older beneficiaries, especially those with serious and complicated medical issues. And we're going to go into some of that. Financial experts tend to recommend original Medicare with the Medigap policy. I can only ask that if you are within 6 months of enrolling in your Medicare Advantage plan, to take a few minutes and do some comparisons. Even though, again, your costs for your premium may be higher, your overall coverage and care may be a lot better. And remember, if you use if you can get LLS grants, and I understand they're closed again, they were open for a short period of time, or HealthWell, some of those things can help bridge that cost gap if you're thinking about the premiums being too high, so that you can get a better coverage through maybe a Medigap policy. So you'll generally get better overall coverage with better options for those of you who seek care and where you receive your care. You don't have to worry about staying in network as much. Next slide. So some of the common reasons people have for Medicare Advantage versus traditional Medicare with a Medigap add-on is perceptions of the overall cost. Perceptions, and that's the key word, of overall cost. In 2023, 60% of Medicare Advantage plans with prescription drug coverage had no premium. Sounds really good, right? Keeping that money in your pocket. And that's really good if you are in good health, because you're not paying out anything anyway. But it could be a big problem if you suddenly find yourself unhealthy, or if you find yourself in an area where you don't have specialists. You know, that may mean if you get a plan there, you may have to go out of network for health. That's going to add on to your cost. For example, at age 65, let's say you enrolled in Medicare Advantage plan and you were content for over a year, then you become ill. You know, we're all healthy until the doctor says you're not, right? Now you can't switch back to Medigap plan. You've lost your window of guaranteed issue, no matter what health condition you're in. Through a Medigap, though a Medigap plan may cost more for a premium, it may provide you with better coverage and overall less cost over the period of time, over the term. So next slide. So some of the advantages, the Medicare Advantage may seem simple to use. Everything's bundled together. You have your prescription costs, you have your things that'll cover Medicare Part A, Part B, and some of those gaps. But you need to make sure your providers are in network every year. And, you know, a lot of people buy their Medicare Advantage plan and they think, that's it, I don't have to worry about it. But yes, you do. And you need to shop again every year for the best plan for you, not just if it's Medicare Advantage, maybe okay, but you need to make sure that the Medicare Advantage has not dropped out, or your providers haven't dropped out of that particular plan. Providers often, again, fall out of network. Another need to review every year, because going out of a network is so much more expensive, and it may be a ways before you can get some, you may have to travel more to get to that person who's in your new network. So be aware that although those extras such as your dental, your vision, those things are very, very tempting, they are also limiting your coverage. Many experts say that choosing a healthcare plan for the dental coverage and gym membership is missing the point of insurance. It really is. These are generally the lower cost of needs anyway, as compared to the cost of healthcare, especially if you're paying for that cancer, the high cost of cancer. So look at your entire cost, not just what you're going to be saving on premiums. Next slide. So some of the complexities and problems with Medicare Advantage, they're very, very complex. And the plan offerings based on your zip code, it can be overwhelming. Some people may have 100 different plans available in their area. That's very confusing. How do you do comparisons with that? There's additional costs for coverage. Though bundled, there may be extra fees like drug deductibles, specialist visits, copays. There's a lot more added into Medicare Advantage plans that a lot of people, I think, seem to overlook. There's state-specific coverage. Original Medicare offers the same coverage across the United States. However, Medicare Advantage plans may only offer specific coverage in specific areas. Let's say, for instance, you had Medicare Advantage plan and it happens to be a United Healthcare. That United Healthcare plan that you may have in Louisville, Kentucky may be different from the United Healthcare plan you have in Austin, Texas. So you need to compare the plans in your specific zip code area, and there may be a lot of them. If you move to a new service area, say you move from Louisville, Kentucky to Austin, Texas, your current Medicare Advantage plan may not be available. So now you got to re-enroll, special enrollment period. Unlike traditional Medicare, Medicare Advantage plans may offer a lack of coverage when you are traveling. Let's just say you went over to Spain or France or anywhere outside the country, or maybe just across the country. You may find that your plan is not in network, or you may not have coverage at all if you're out of the country. So this is the time of year everybody's traveling. I'm going to be going to France for a few weeks in April, and we're probably going through Spain and some other places. But I know that I'm not on Medicare, but some of the people I'm going with will be on Medicare. So I'm talking to them about options they need to make sure they're covered in the event they become ill. You all need to do the same thing. Next slide. So while some Medicare Advantage plans offer long-term savings, like plan flexibility and better care, others can lead to fewer provider options, additional costs, and lifestyle changes. So you need to look at your plans. Please, 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 please look at that Medicare Advantage plan. So there's types of Medicare Advantage plans. There's HMOs, health maintenance organizations. They utilize in-network doctors that require referral for specialists, time drain on your referrals. PPOs, preferred provider organizations, charge different rates based on in-network or out-of-network service. And then there's private fee for services. These are special payment plans that offer provider flexibility, and their costs may be a little bit more. Next slide. In addition to that, there are SNPs. Those are special needs plans. And a lot of people are not aware of these, but you may want to look into the offers Medicare have for special needs plans. It provides help with long-term medical costs for chronic conditions. And so when you're going to do comparisons, tell them about your illness, tell them about your medications, tell them about treatments, upcoming treatments, and they can look at those and compare those plans for you for the Medicare Advantage. Medical savings accounts, or MSAs, are paired with high deductible plans, can help you offset a lot of that out-of-pocket cost. And these are areas, again, that people seem to forget about or don't pay attention to, but it can really provide you with additional savings, additional help when you're paying a lot for your out-of-pocket expenses. Next slide. So here's how not to choose a Medicare Advantage plan. And I hear all the time, this is the number one thing. People choose one because your friend has one. Do they know your healthcare needs and what you can or cannot afford to have and what you may need in the future? Everyone have different needs. Don't just get it because somebody said my healthcare Advantage plan took care of me for this particular illness. Well, they may have another illness next year, or that same illness, and next year that Medicare Advantage plan may not take care of. Everybody's needs are different. Please don't go by word of mouth. Choosing based on an ad you saw on television. This is something that's been very, very prevalent the last year or two. And it's getting a lot of people into trouble because they're always saying low premiums or no premiums at all, but you're going to get what you pay for. Probably subpar care or less access to care. So you need to read between the lines. You're probably not going to get very good overall coverage because you're not paying for anything. You definitely get what you pay for when you're talking about medical insurance plans. Know that ads are becoming increasingly misleading. In fact, the Biden administration is looking at ways to prevent a lot of this misleading in Medicare Advantage advertising. Next slide. So the Centers for Medicare and Medicaid Services are now requiring that insurers get approval from federal regulators before airing TV ads. But there's always those offshoots, those little third, fourth, whatever people who want to do these slides, and maybe an individual person who's providing Medicare or information that is touting those TV ads, the low cost or no premium. They're going to get paid to do that. They pay out, they sign people up, they get paid for that. So be aware. So how do you decide to choose a Medicare drug coverage? First of all, you need to understand Medicare drug coverage, copays, deductibles, and all that. So now we're going to go into that. So there's phases to Medicare Part D. Medicare, again, Part D, most of you know this, is your prescription drug coverage. So let's review some of the upcoming changes. In 2023, there are 4 distinct phases to Medicare Part D. Some of you have found yourselves in these uncomfortably, where the cost-sharing drug costs paid by Part D enrollees, Part D plans, drug manufacturers, and Medicare varies. So comparisons, we're going to do comparisons 23 to 25. Next slide. There is a deductible phase. Enrollees pay 100% of your drug costs up to your deductible. That's up to $505. Note, not all Part D plans charge a deductible, so you need to be aware of your plan. However, in the standalone Part D plans, many enrollees are responsible for a standard deductible. You're always going to have a standard deductible. The initial coverage phase, that's Part D enrollees pay 25% of total drug cost, and Part D plans 75% up to the total cost of $46.60. So that would be considered your max out of pocket, right? Most Part D plans charge a mix of co-payments and co-insurance rather than the standard 25% co-insurance rate. So you need to understand what yours cover. 2025 changes. There's nothing changing in 2024 on this particular thing on the initial coverage phase. 2025 changes. Drug manufacturers will be required to provide 10% discount on brand name drugs. This will replace a 70% price discount on the coverage gap phase under the current benefit design. That was 22 and 23. Part D plans will pay 60% of brand name drug cost. So I need, for all of you, when you go through this, please get your, when you get a copy of these slides, highlight these things that are very important to you so you can remember what you need to go talk to about when you're talking to people on your Medicare, doing some comparisons, and find out what your total max out of pocket is going to cost. So the next phase. Next slide. This next phase is coverage gap phase. This is where a lot of people get stuck with that horrible donut, right? Part D enrollees pay 25% of the total drug costs for both brand name and generic drugs. Part D plans pay the remainder, 75% of generic drug costs and 5% of brand cost. Drug manufacturers provide 70% price discount on brands. Note, there is no manufacturer price discount on any generic drug because supposedly they're a lot less expensive. Well, that's kind of laughable because a lot of you all who are on Revlimid have found that that generic is only a few $1,000s less, and really it's not really a big help in that overall cost to you. Hopefully something's going to change in the future. 2025 changes will include a new $2,000 out-of-pocket cap. Yay, yay, yay. That's the one everybody's waiting. I don't know why they didn't do it sooner. Everybody's trying to gather as many dollars as they can now. This cap does not apply to out-of-pocket spending on Part B drugs. Those are drugs that you get when you're doing IV things, when you're in the hospital. Those are your Part D drugs. Those are paid under your medical plan. Elimination of coverage gap phase, a higher share of drug costs paid by Part D plans in a catastrophic phase, along with a new manufacturer price discount and reduced liability for Medicare in this phase, and changes to plan cost and the manufacturer price discount in the initial coverage phase. So that $2,000 out of pocket is going to be huge for a lot of you who are paying a lot of money on your prescription cost. That's 2025. So be aware that you're going to still have a higher out-of-pocket cost for 2024 and the remainder of 2023. Next slide. The catastrophic phase. Medical care pays 80% of the total drug cost. Part D pays 15%, and Part D enrollees pay 5%. Part D enrollees qualify for catastrophic coverage when the amount that they pay out of pocket plus The value of the manufacturer discount on the price of brand name drugs in the coverage gap phase exceeds a certain threshold, and that right now is currently set at $7,400, of which the enrollee pays $3,100 out of pocket before reaching the catastrophic phase. This is based on the cost of brand name drugs only, does not include the cost of generics. I know this is all confusing, but if you'll take these and look at it and compare and understand and look at the comparison between 2022, 23, 24, 25 cost, it'll make a lot more sense. And you'll be able to determine which actually plan you need to get on if you need to change out of some of these Part D prescription plans. Next slide. So 2024 changes, 5% coinsurance requirements for Part D enrollees will be eliminated. Yay. And Plan D pay, the Part D plan, your prescription out of pocket will pay 20% of the total drug cost instead of 15%. So that's better. For Part D enrollees without low income subsidies, once drug spending is high enough to qualify for catastrophic coverage, you'll no longer be required to pay 5% of their drug costs, meaning out of pocket is capped. In the 2024 changes as well, the catastrophic threshold is capped at $8,000. This includes what Part D enrollees spend out of pocket, includes your out of pocket, plus the value of the manufacturer price discount on brands in the coverage gap phase, huge, plus the value of the manufacturer price discount on brands in the coverage gap phase, meaning in 2024, Part D enrollees who take only brand name drugs will have spent about $3,300 out of pocket and then will have no more additional costs for these drugs. I hope you understand how important that is going to be for people who are doing Revlimid, where they go through this every month, maybe January, February, they've already paid that max. For the rest of the year, for those drugs, there will be no additional cost for this drug. That's going to be huge. Next slide. 2025 changes. Medicare share of total costs in a catastrophic phase or the reinsurance will decrease from 80% to 20% for brand name drugs and from 80% to 40% for generics. Medicare Part D plans share of the cost will increase from 15% to 60% for both brands and generics above the cap. And drug manufacturers will be required to provide a 20% price discount on brand name drugs. So list out the cost of your drugs now, list out where you're getting the discounts on. And remember, you can still, when they open up, you can still use LLS HealthWell for some of your premium costs. You can direct some of that premium costs to your out-of-pocket cost when they open up. But then you also don't forget to call your the pharmaceutical company that provides assistance as well as some of those brand name drugs. You'll find you're paying out of pocket a whole lot less. Next slide. So the importance of all these changes. So for all of those who are taking those high cost cancer drugs such as Revlimid, Pomalyst, there's Imbruvica and Jakafi and Ibrance. These drugs have the highest cost per capita Part D expenditures in 2021. Same thing for 2022. The annual out-of-pocket cost for these drugs can range from $11,000 to almost $15,000. And for a lot of you, that's like monthly for some of these drugs, right? And in the catastrophic phase, out-of-pocket costs per drug in 2021 ranged around $8,000 to nearly $12,000. So eliminating the 5% coinsurance requirement in the catastrophic phase in 2024 means that Part D enrollees without low-income subsidies who use these and other high-cost cancer drugs, because you can be on more than one, covered by Part D, will realize thousands of dollars in savings. Now, I need you to understand this as well. If you want to do something else to actually pad your pocket, Medicare savings accounts, medical savings accounts are going to be going up to $10,000. So you can save in there, and that can help you also to offset some of these costs of drugs. So plan for those. You can see the savings, especially if you use more than one of those medications, like the Pomalyst or the Revlimid, or some of those other drugs that are pretty high cost. Next slide. So additional changes to Medicare Part D in 2024. People with Medicare who have incomes up to 150% of the federal poverty level and resources at or below the limits for partial low-income subsidy benefits will be eligible for full benefits under Part D low-income subsidy program. The partial low income subsidy benefit currently in place for individuals with incomes between 135 and 150% of federal poverty levels will be eliminated. So those with low incomes, there's going to be additional benefits for you. The calculation of the base beneficiary premium will be adjusted as needed to limit the increases in the base premium to no more than 6% from prior year values. Note, the premiums for individual Part D premiums and annual plan level premiums increases will continue to vary by insurer. Be aware of that. It can change from, say, it will change from state to state and from insurance plan to insurance plan. So be aware of those costs. Next slide. So now let's go into Medigap. Medigap, I really wish people understood this more. Medigap is a private insurance paid, you buy this through private insurance companies. So I'll go over the pros and cons of Medigap plans. Again, if you have a chronic and expensive illness and require specialists, I would highly recommend those of you who are still in the guaranteed issue period to compare coverage, the pros and cons and costs between Medicare Advantage plans and Medigap. Medigap policies cover the gaps in original Medicare Part A and Part B, including deductibles, co-pays, co-insurance, blood and foreign travel emergencies, up to the limits of the policy. Plans cannot include extra benefits like dental, vision, hearing, prescriptions. That is left up to Medicare Advantage plans. Next slide. So here's something I want to add in real quick. If you're using a Medigap plan and you want to get some lower cost dental or lower cost vision, here's something a lot of people don't realize they can do. If you have a teaching hospital in your city or you're somewhere close to you, you can go to their dental school. They will provide you with care at a whole lot less than sometimes if you had insurance, your insurance would pay. So, and their care is really good because they have the people who are training, their doctors are dentists, and they're going to make sure they do the best job. So you're going to get oversight on your dental care. Same thing with vision. You can do that same thing. If you have a school for vision near you, you can go to them and get a lot of reduced care, but the quality of care is still there. So continue with the Medigap. During a Medicare beneficiary's guarantee issue period, they cannot be turned down for coverage, no matter what your illness is. The guarantee period is the initial enrollment period, which starts at age 65. Even if you're working and have insurance somewhere else, your initial enrollment period that you have access to Medigap plan is still age 65. The Medigap open enrollment period starts the first month you sign up for Medicare Part B at age 65 or older and ends 6 months later. This includes those individuals who delayed Medicare enrollment because they had creditable coverage through their employer. You can switch plans without any issues during your open enrollment period. However, after that period is over, that's 6 months, you will go through underwriting and can be turned down if you then apply for your Medigap policy. Otherwise, your policy cannot be canceled unless you do not pay your premiums. So if you want to consider the Medigap, you're still eligible for Medigap during your open enrollment period, your initial open enrollment eligibility period, age 65, then please do your comparisons between Medicare Advantage plans that are offered in your state and your zip code. Compare those with your Medigap plans. Premiums may be higher, but look at the overall cost, especially going in the year 2024, where there's going to be a lot of changes in some of that Medicare Part D. Next slide. Insurance companies can also delay coverage for up to 6 months if you didn't have creditable coverage before signing up for Medicare. So let's say you had insurance like Cobra. Cobra is not considered creditable coverage. If you're on Cobra and then you sign up and you didn't get Medigap because you had Cobra and it was covering other things, you're going to have to wait to sign up for Medigap plan because you didn't have creditable insurance, even though insurance may be seem exactly the same that you had through your employer. Next slide. So Medigap pros are great reasons for getting it. You get comprehensive coverage. It fills the gaps in original Medicare Part A and Part B. Medicare Advantage plans do not. Standardized coverage. There are 10 Medicare supplement plans in 47 states. The other states have other options that have exactly the same coverage. Medicare Advantage plans are not standardized, which makes comparing them very difficult. And you may have a state that may have 100, 150, 200 different plans. That makes it very difficult. There are no annual changes. Medigap plans benefits rarely change, and it generally takes an act of Congress to make those changes in the Medigap plans. Medicare Advantage plans change annually, if not more, depending on if that insurer is solvent. Nationwide provider network. Use providers nationwide who accept Medicare. With most Medicare Advantage plans, you are restricted to a local network of providers. So you don't have that ability, the flexibility to go from one state to the other state. If you see a specialist in one state, you're going to, in your own Medicare Advantage, you're probably going to be going out of network and may have to pay out of pocket for that care. Medicare and Medigap plans, you do not have those problems. So can you see where there may be some benefits to that? Next slide. So again, they have no deductibles. All plans except Plan A pay all or part of the Part A deductible. Some Medicare Advantage plans have deductibles and some don't, but you got to be aware of those and do comparisons. There is no co-insurance on Medigap plans. All plans cover Part A and Part B co-insurance. Medicare Advantage plans co-insurance rates vary by service. All but 3 plans cover 100% of all co-payments. The 3 plans that don't have low co-pays are pay 50 to 75%. Medicare Advantage plans copay rates vary by service. So you can see where Medigap plans may be a lot more, that might easier to understand. They give you better coverage, and you may not be paying as much because you don't have deductibles, don't have co-insurance, and all those other things. So please do your due diligence if you're eligible to still participate in the Medigap plan. Next slide. Another thing, they're very easy to budget for. Medigap makes budgeting very easy. With a Plan G policy, for example, once you have paid the annual Part B deductible, you don't have to worry about the out-of-pocket expenses. It's all covered by your monthly premium. With Medicare Advantage, you continue paying out-of-pocket until you've reached the maximum out-of-pocket limit, up to $75.50 in this year. They also have guaranteed issue rights. You cannot be turned down if you apply during that initial enrollment period at age 65. When you're first eligible, please be aware of that. Guaranteed renewable. Your insurance company cannot cancel your policy unless you fail to make your premiums. Policy renews automatically every year. You don't have to go back there and change it or find out if your providers or where you service providers like your cancer program or wherever you get your treatment has fallen out of the Medicare Advantage plan. So you don't have to worry about that. You're in there. It's a private insurance, and you don't have to worry about those things. Next slide. You get a free look period. You have 30 days once you sign up for Medigap to decide whether you want it or not, once your policy is approved. So if you change your mind, you can drop it and receive your initial premium back and go to Medicare Advantage if you wanted to. You can change anytime. You can cancel or change your Medigap plan or insurance company anytime you want. With most companies, this will require a medical underwriting process if you want to go back into Medigap. So if you already have an issue, you're approved through that guarantee issue period, be aware that if you drop it, you may not have to go to underwriting and they can say, no, we're not going to insure you anymore. If you are in a good health and don't have a troubled health history, the process is generally quick and easy. If you have a medical history, you may be denied coverage. Do your due diligence before you cancel something, okay? Next slide. And of course, everything isn't perfect. So these are the negative problems with Medigap. They have higher monthly premiums, and a lot of your Medicare Advantage may have low premiums or none at all. For some people, the premiums may be too expensive, but I need to have you all understand that just because a premium is high, your other costs may be lower. So if you look at it all together, you may find that it's even less expensive than doing a Medicare Advantage plan. They're sold by private insurance companies and their rates can vary, though their coverage cannot. From state to state, their coverage remains the same. They do not include a Part D prescription option, which means you'll have to go out and buy another Part D plan for your prescriptions. Difficult to switch if outside of an enrollment period, because if you already have a medical issue, once you're outside of that initial enrollment period, You'll have to do underwriting, and they're going to look at your history, your medical status, and everything. There are inconsistencies. There are inconsistencies from state to state. Every Medigap policy does not have to be offered in every state. So you may have maybe have a L that's missing in one state when L may be in another state. And the policies can vary widely. So be aware of what you're getting. Some states standardize Medigap policies differently. So be aware of that. These are private, so they can do a lot more that they want to do with those policies. Next slide. So if you want to get comparisons, please take the time to do it. It is well worth it. You can go to these 4 links and they do work. Sometimes some of these links don't work, but we check those, Audrey and I, to make sure those links do work. Please go on there and do your due diligence, and don't wait till the last minute to do it. There can be complicated, especially if you're looking at Medicare Advantage and you don't have the option to choose Medigap plans. So please go and look at those things. So in summary, again, you hear me say this again, do your due diligence. It's up to you to do the legwork to make sure you're getting what you need. Review your needs yearly, most especially on your Medicare Advantage plans. If you're nearing Medicare age, look at both options for Medicare Advantage as well as Medigap plans. Don't listen to your neighbor, what they have. And as always, don't just look at the premium. There's a lot more that goes into your total out-of-pocket costs for insurance. Understand the timeframes for enrollment and options for changing your plans so that you won't get locked out or you can't change out of them when you need to change. I hope you all have found this beneficial. And I'll be glad to hear some questions if you have any, or take some questions.
Awesome. Thank you, Diana.
Mhm.
I really appreciate this webinar. I think you bring up so many important things. I mean, we get asked this every month, every week almost, and lots of great reactions. Lots of people really liked this webinar. So I hope you can see those, Diana.
I do.
And such a great topic to hit because it applies to so many people, and because financial toxicity is such a real I'll use the word threat to myeloma patients and their families who are trying to figure out if survival includes financial survival. It's just ridiculous in my personal opinion. But that being said, we have a lot of awesome questions. And so I'm going to get started with them. To our audience, you're welcome to put in those questions. And we will get to them. So let's start with Derek. Derek is wondering what the best version of standard Medicare is if one looks to be on Revlimid for several years.
Okay, so again.
And can you move the microphone a little closer to you, Diana?
Can you hear?
Yeah, much better. Yeah.
Okay, again, because it can vary from state to state. I don't know what state you're in. They have like Medicare A, F, G, L, all these different plans. There's like 9 or 10 of them. They can change and vary from state to state. What they offer in those particular AL will remain the same, but every state may not have L, or every state may not have G. I think G is not available unless you were eligible for Medicare in 2020 to sign up, but F is the most comprehensive. You can, and in fact, what I'm going to add on here, Audrey, when we're finished, I'm going to add a chart so people can look at those Medicare plans. They'll have to check with their state to see what they offer, but it'll tell you what each one of those Medigap plans offer. So you can look at the standardized care. It'll tell you what's standard for each plan.
Awesome. That's really helpful.
I'll add that.
Okay. Question: will the insurance companies still be able to make their money in 2025 with expensive drugs, or will they just stop? Is there a possibility that they'll just stop covering a lot of them?
No, insurance companies will make their money. I'm telling you, that is where insurance companies will not lose money.
Okay.
In fact, when you're paying for your out-of-pocket for your prescriptions, you're paying more than what it actually costs to make those drugs, continue making those drugs. A lot of them have long since been paid for the development costs of those drugs and the advertising for those drugs. So no, they're not going to be dropping those drugs. You may find them very more like now, some cancer drugs are very difficult to get because of manufacturing problems. So that might be the problem versus insurance company dropping, because that's where they make their money.
Mm,
Or pharmaceutical companies dropping them, and insurance companies are not going to drop them. They may change on the tiers on that, but they're not going to drop them.
I will say something interesting right now. If people are familiar, ASCO is going on, which is the American Society of Clinical Oncology, and it's their annual conference. And as part of my job, I've been attending virtual sessions. It's really encouraging to see the doctors call out difficulties such as these financial toxicities and really express like in the future, we're going to really sit down with, well, they already are doing this, but they will continue to do so. Sit down with these pharma companies and just express, we need to find a way to make CAR T more affordable, more accessible. We need a way for these drugs to not slow down just because you make less money. They're still as needed in the myeloma community. So I just want to echo that um, nobody wishes myeloma upon anyone, but these myeloma specialists are special people who really care about their patients. And it's really exciting to see that it's not just the patients advocating for themselves in this area, but also the specialists.
I think
Because
that
that's
probably in
important.
the future, one thing, so people can understand how a drug gets the cost on it, and what your actual percentage of that cost is. You'd be surprised. Pharmacy benefit managers are the ones who decide, are negotiating these prices, right? And what they may negotiate with a hospital, whether they may negotiate with what insurance is pay, is completely different from what that cost of that drug is. And you may be paying more than the hospital may be paying for that particular drug.
Yeah, yeah, it's interesting.
It is.
Complex. All right, Leanne has a great question. If she becomes Medicare eligible in November, is automatically enrolled because of drawing Social Security, can she keep her current healthcare policy throughout the year end while she shops for different Medigap policies?
So when she becomes available, she can keep it. I mean, but be aware, she's probably going to be only enrolled for Medicare Part A because she's
Mm,
on disability, she's under age 65. She'll probably have to enroll in Part B and then look for another plan to cover those gaps.
yeah. All right. I don't know if you've ever seen the meme online where the lady's like trying to compute all of those mathematical equations in her head. That's how I feel today, where it's like Medicare Part D plus A plus
What's
Medigap
changing?
plus.
Catastrophic, yeah.
Yeah, exactly. Okay. Um, okay, so this is kind of a similar one. If I take Medicare after retiring at 67, that's a general number, not specifically, but let's just say 67. Can I get Medigap automatically without underwriting?
Medigap is never automatic. It's a private insurance company. You automatically get at 65 Part A. Part B, you can enroll in or not. If you delay enrolling in Part B, you may be charged the cost for that. That's ongoing for the rest of your life. I know there's a lot more intricacies when it comes to Medicare. It's the most complicated thing in the world. And then at age 6, if you're older than 65, then you need to, if you have private insurance through your employer, then you got to decide if you're going to go and enroll in Part B, so you won't end up with additional costs later on. And some people will go in and enroll in Medigap policy at age 65, so they won't be knocked out, because after that initial enrollment period, if you have an illness, you're not going to be able to get in it, or they're
Yeah.
going to deny it.
Let's talk about that because Joette's saying I'm over the 6-month initial Medicare enrollment. I'm covered by husband's employer who provided insurance. Have I lost the opportunity for Medigap?
If it's over six months at age 65, you probably have. You can try. If you don't have any health issues, you can try. They don't have to, you have to do an underwriting after 6 months.
Okay. Once this person here is asking what your personal background is in finance, they're just amazed by your presentation and very happy with the information. And they're also wondering if they should consult a broker for assistance with these kind of things.
You could, but be aware of broker. My background is I'm a financial advisor, so I'm also licensed in health insurance, long-term care, and all these things. And I've always been interested in this all my life. Have been in my background is over 23 years as a financial advisor with everything, doing finances with broker, cryptocurrency, all that stuff. I do all that stuff. But I became more interested when my husband became ill, and I realized there's a lot I didn't understand. So, what I read all the time? in the morning, going to bed, I wake up thinking of something, and in the middle of the night, I start reading and researching. This is what I do. I instead of listening, I can have the television on, and I would have turned it on, but I haven't turned it on anything. And it could be that way for 8 hours. I'm sitting there researching and reading because I find this topic so fascinating, and it's ever moving. It's very liquid. Um, and so I find it fascinating. And the more you read, the more, I hate to say this, the more you realize there's a lot out there that you don't understand.
Yeah.
And
Yeah.
when you have these lawmakers making these changes and saying, we're going to fight this, fight that, I guarantee you, none of them really understand Medicare. That page is probably a book that comes out every year. It's probably a foot thick. They are not reading it. They're not reading it. They don't understand. It's very complicated.
But with the broker, let's answer the question about the broker here, because I feel you, but we could talk about this all day and I want to make sure we answer
Yeah, you
questions.
can go to a broker and they can do comparisons for you, but be aware of the broker. Find somebody who's non-biased, who looks at all the plans in your area, because some brokers will only sell certain plans to you because they're going to make more money off of those plans.
Interesting.
Those
Yeah.
links I gave you will give you a better idea, a better place to go.
Take a little bit more effort, but at least you know that you're doing it yourself.
Right.
I see someone here signed in late. Will info be available? Yes. Diana's slides and this recording will be sent to all registrants via email within 48 hours. Okay, so another question here. Paul's wondering, has Medicare Part A still working at 66? So also has private insurance. Can he sign up for Medigap when he retires with pre-qualifying?
At 66? No, he can try, but he's over that 6-month period from age 65.
Okay,
He will not get guaranteed issue, especially if he has pre-qualifying issues.
all right. And then can you switch Medigap during each year enrollment period without going through underwriting?
No, you can switch, but if you have a medical issue, they're gonna try to throw you off those
Yeah.
roles. Once you're in there, you may be able to switch policies, possibly if they're very much the same. Especially if that 6-month period, you can do whatever you want in a 6-month period. But after, if you got completely off of Medigap and say, oh, I want to go back on Medigap, no, good luck.
But if you stay on Medigap during open enrollment, can you change without having to go through underwriting?
Yeah, Medigap does not every year like you go through Medicare Advantage. You can change. No,
Oh,
Medigap is because there's a private insurance plan. You can be on that Medigap policy and stay on that Medigap policy for 5, 10, 15, 20 years. You don't have to re-enroll.
oh, okay, interesting. All right. Who is or is not eligible for an MSA, which is a medical savings account, I believe.
Medical savings accounts are for people for high deductible plans. Medicare Advantage may have high deductibles, so they're high deductible plans, and a lot of private pay have medical savings accounts as well. What's great about these is medical savings accounts you can use for medical, and a lot of people, because can put up to $10,000 in next year, and you can keep adding to that every year. A lot of people use that supplemental for retirement, or supplemental if they knew there's going to be additional healthcare costs coming up down the road, because the cost of healthcare is just going up. And so they will build that account up for out-of-pocket needs. But it has to be a high deductible plan that you're in for medical savings accounts.
Yeah. Okay, lots of questions, and I know it's complicated. It really is like that. So everybody's like, what? What's going on? We'll go through them, and then if you can't answer them, great. And if not, maybe we'll just have them connect with the financial coaches on our website. This person saying has basic A and B and Medicaid as of initial sign up in April in 2023, so this year. Can I switch to supplement plan? And if so, how long do I have to make the change?
When did you turn age 65?
Mm,
The 6 months from there is the key. That is
So
your guarantee
6 months from turning 65.
65.
I need to let my parents know. This. Okay, Mark is saying I work and my coverage is creditable. Is it correct that I do not have to sign up for Part B, Part D, or Medicap at age 65?
That is correct. You don't have to,
Okay.
because you have credible insurance. However, if you didn't enroll in Part B when you're first eligible, you may have additional costs on that later on.
All right. This attendee says currently on Cobra with employer and I'm 61 years old. I'll be eligible for Medicare on Social Security disability in 12 months. Will I be able to sign up for a Medigap plan since I'm under 65, or will I need to wait to sign up?
Interesting. Some states will offer some things that are very similar to a Medigap plan. Other states won't. You have to get online and find out. But generally at age 65 is when you can get a Medigap plan.
Interesting.
Probably the chances are you probably cannot until 65.
Yeah. Carl says recently signed up for Part D and noticed the out-of-pocket cost for Revlimid is approximately 20,000 to 160,000 per year. Am I understanding this correctly?
That's how much it is, but that is not with it being paid for your
Yeah,
prescription plan. That is your raw street cost.
yeah. So that doesn't include coverage of that
Right.
drug.
Right.
Mhm. So maybe look a little bit further into that. Okay. Um, is there a big problem with Advantage plans rejecting claims or requiring ridiculous pre-approval paperwork?
There can be, especially if you're going out of network and you're going to a different provider like a specialist, and things are you could, and there is one of the biggest pullbacks on Medicare Advantage is the time for pre-certification. You may be denied, having to go through that appeal process. We know that can take weeks, sometimes months to go through the appeal process. Meanwhile, you're waiting to get treatment. Um, I That's why I think it's very important, very. I encourage everybody to look, if you're eligible, you can look at a Medigap plan, because you won't have these issues. You won't have those issues at all.
Yeah,
And so, treatment is not just financially, not getting treatment is not just financially costly, but it's costly to your health.
yeah, yeah. A couple questions here about how much can you earn to qualify as low income?
Usually 135 to 150% of federal poverty levels. You can Google that, and and that level is based on how many people are in your household.
Federal poverty level and
Uh-huh.
150% of that.
135 to 150%.
Okay. And then does it depend on assets that you have or
They
just
don't
your,
look at assets, they look at income.
okay. Good questions here, everyone. I love it. Okay. Good question here. Do you know if any pharmaceutical companies offer copay assistance for Revlimid or lenalidomide like they do with regular insurance plan? I won't be Medicare eligible until next January, but likely won't retire until later of 2024.
Yes. Bristol Myers Squibb offers financial help for Revlimid, and a lot of people don't understand. Again, I'll say this again, because people keep calling me saying I'm on Medicare and I was told I cannot get pharmaceutical help. You can, if you ask for that program. Say I'm on Medicare, can I get help for my Revlimid on Medicare? Because that's considered, you may be underinsured, and
Mm.
they have a different program for those people who are on private pay versus the Medicare. You can still get help.
Yeah, advocate for yourself, especially when it just comes to these ridiculous prices.
And again, look online, because we have those financial resources with the links to find
Yep.
those companies based on whatever medication that is.
Yes. Okay. Why is Cobra not considered credible coverage?
Federal government question. Because you're paying for the whole thing. Nobody's really um, that's a good question, but it's not considered credible coverage
Okay.
by federal government.
Yeah. Okay. If drugs are through an Advantage plan, are there any changes if you get your drugs through an Advantage plan?
Changes to what drugs are going to be on there. We'll know how that's going to change in September. They'll know when things are going to change, when tiers fall down on a tier, go up. It's going to vary based on changes in September, effective in
Okay.
October.
Okay. And a couple questions here. So it's always 6 months after turning 65. It's not 6 months after retiring
For what?
for
Medicare
being able
Gap.
to enroll in Medigap. Mhm.
Medigap is from your initial enrollment option to get into Medicare. That would be at age 65.
Okay.
60.
Because when sometimes, let's say you're 67, you can retire and then enroll into Medicare, but not Medigap. Is that
Right.
true?
Medigap is from initial enrollment, your eligibility to be initially enrolled in Medicare.
Okay, this is good to know. They're tricking us. Maybe not. Don't quote me on that. I forgot this is recorded. Okay. Um, okay, so Mark says, I thought higher penalties for delayed enrollment in Part B do not apply if you delay because of having creditable coverage. Is that wrong? What about Part D and Medigap?
Part D, if fine, Medigap is still initial enrollment period. And some people find themselves paying twice for insurance because they want to make sure they have it and have the option to have it when they're later on. Part B, you can delay enrollment in Part B because you get coverage, and you can later enroll in Part B, but you may have a higher cost to it because you deferred enrollment into a Part B plan. Now,
Mm,
if you're covered through your hospitalization, everything through your provider, your private insurance through your company, talk to them. A lot of times they'll tell you when you need to coordinate with Medicare. Talk to them.
okay.
Talk to your individual private insurance company. They will tell you. They have different options available for you.
Yeah, you can tell how much research you put into this, Diana. Thank you. Thank you
If
for
you're a state employee, it's even different with a state employee as well, how they coordinate their insurance. And a lot of times it's with a state employee and you have another, you have like legal aid society, you work through them as a manager, you're a state employee, you can be on Medicare, you can be on a private insurance, and you don't have to worry about anything because you're a state employee. There's a lot of benefits for being a state employee.
Interesting. Um, okay, should I look for a self-pay medical insurance company to replace my Cobra so that I have creditable coverage? Credible. Is it creditable or credible?
Creditable. People say it differently.
Creditable. Okay.
It depends. You may find that if you find a private payer, if you go through the exchange or Affordable Health Care Act, go through there, you may find yourself paying a lot less out of pocket. A lot of people don't realize that you can go through ACA, the Affordable Care Act, or exchange. Even if you're employed have an employer with great insurance, you may find the same insurance through the exchange, but it costs a whole lot less.
Okay. Cindy says, thank you for stressing that we need to check into Medicare enrollment when we turn 65 rather than putting it off for later. My sister-in-law thought she was helping herself by using private insurance until 69 and is now paying a lot more for Medicare due to her mistake. It's just, this is why education classes like this are so important. And thank you, Diana, for being the one that spreads the message. It's really important. Donna says, Medicare Medigap has been a godsend. I was diagnosed with myeloma 1 month after going on Medicare. Getting my care has been much easier than when I was on private insurance. That's great news, Donna. Thank you for sharing. Last question here. Nancy's wondering, what if you have employer paid advantage plan as a retiree? Would you still have a benefit to a Medigap?
What age are you? Again, let's go back to age. If you're at 66, 67, and you have great Medicare Advantage through your employer, and that's what you're getting, or Medicare through your employer, then you still cannot go back and get that Medigap because it's still age. There's that age is the determining thing, age and the 6 months.
Yeah. Yeah. Okay. I said last question, but we'll ask this last one. I'll
Okay.
let it slide. I'm just kidding. Is the exchange a creditable coverage health insurance plan?
Yes, they're the ones who actually tell you. The federal government put the exchange or marketplace plans on there, and they are all creditable. They everything has to be all the other plans out there have to go in line with what those exchanges are, because the government said these are the things that have to be in line with the plan, which means you cannot be denied based on except for Medigap, you cannot be denied based on medical history. You know, you have access to care no matter what, and there's no gap on like a cap on 100, like used to be $1 million for that insurance to pay. There's no longer those caps on those things.
Okay, good to know.
So yeah.
All right, Diana, anything that you would like to, before we finish up with our outro announcements, anything that you would like to say to the audience?
Please, please, please look at your plans. Don't wait until September. Start looking at things now. Look at those links and start putting things in. You can always go back there and change it if you need to, if you have different treatment options or different things to change, and anticipate what's going to be going next year. Talk to your doctor. You know, you may be doing well next year. Say, do you think I'm going to get stem cell transplant next year? Let's say if I fall off of this type of treatment, Do I now look at a CAR T? Start looking at your options now. Be proactive, because if you wait till the
Yeah.
last minute, the chances are it's going to cost you a whole lot more.
Very good advice. Thank you, Diana. Well, I'll finish up today with just a couple of outro announcements. Our next meeting will be next month, and we're going to be meeting on the 11th since our normal meeting date is on a holiday for the United States. And then we're going to talk about life insurance, how to obtain it, and how to maximize it. After July, we will be starting to meet every other month as part of the financial chapter. It's a general shift that we're making to my program, or the community events program. You'll see more information about these changes being publicized in the future, but we are just going to briefly separate the frequency. What am I trying to say? We're just going to lower the frequency of how often we do these. That being said, Diana is going to continue to research these important topics. She's going to be writing articles for our website, and she will remain dedicated to her mission of making your financial lives easier. So don't be afraid that you won't get that information. We'll just be meeting less often as a group. Other events that you might be interested in, on the 7th is our plasma cell leukemia chapter. That's tomorrow. We're just going to be talking about CAR T and bispecific experiences of PCL patients. And let me tell you, these are encouraging experiences, although not without hiccups. Then on the 8th at 6:30 p.m. Eastern, we're doing our Northeast myeloma chapter. That's for anyone living from Maine all the way to Pennsylvania. And we're going to be discussing nutrition, what are healthy pantry essentials and easy meals. Then on the 13th at 7 p.m. Pacific is our SoCal Myeloma Community Chapter. We're going to be discussing the science and art of creating your personalized myeloma treatment. I actually think that's 6 p.m. Pacific, so I'll double check that and let you guys know. It is that regional chapter, which is why it's Pacific time. The link to sign up for any of those events and more events that I have not mentioned is found at the bottom of the slide and will be included in our follow-up email. Thank you to Amgen, AbbVie, Adaptive, Janssen, Genentech, and BMS for being our sponsors. And thank you to each of you for helping us build this financial community. I appreciate each of you. Hope you have a great rest of your day. Thank you, everyone. Take care.